Hey everyone, welcome to Preventative Health Institute. If you are here on this page, you probably understand that the conventional medical model is crumbling and is unable to help people that are experiencing these chronic health conditions and disease that people are suffering from. So maybe you have, been looking, been interested in a health and wellness practice and been looking for a system that works for you, a program that works for you. Or maybe you've been on this health journey yourself. That was me many years ago. And now we're super passionate about helping other people also regain their health. Or, maybe you are someone that over the course of these past 2 years has either chosen or been forced to walk away from their job, we call it, because of the current narrative. Or maybe you're someone that just understands that this is a huge opportunity right now. Conventional medicine is crumbling. They are not equipped to help people with these chronic conditions. People have lost all confidence in the conventional medicine system. And really the healthcare, we call that the sick care. So this is the healthcare of the future is really what we call a preventative health, model. Maybe you're here because you want to be a part of that. So whatever the reason you're here, we're glad that you're here and welcome you. Okay, so I'm Kendra Duquette. I am the founder of Preventative Health Institute. I'm also the program director. So we just wanted to talk about, our program today. So the Preventative Health Practitioner program is based on a system that we have come up with that has helped thousands of people recover and reverse chronic health conditions and disease, no matter what they may be, autoimmune, cancer, it doesn't matter. And then truly prevent these symptoms from ever coming back. So, symptoms that people are experiencing, that's just your body talking to you. So it's basically, symptoms are unique to a person. So it's kind of like a snowflake or a fingerprint. It's very unique to that person. But the roots that are causing these chronic health conditions are all the same. There are many, many, many roots, and they go very, very deep, but they are all the same across the board. And that's why people are having such a hard time figuring this out themselves, because there's so much, but they're all the same. So that's what our system is built on. So, people around the world are suffering needlessly. That's the problem. It's millions and millions of people, and it's growing. This number is growing quickly, and it's not only affecting the people that, are experiencing these symptoms. It's affecting family members and friends. They don't understand. And these people that it's affecting, not only do they feel terrible, but they are also, they are told by their doctors that this is all in their head, that their tests are all, fine, and they just feel very alone in their situation. So our system works to turn this around for everyone, but the problem is that we can only help so many people, right? We have a small clinic, but it is proven over and over and over to help everyone. So we put this together because we wanted to teach other people to go out and help other people. Kind of like a ripple effect, you throw the rock in the pond and it ripples out. That's the idea with this, because if we can teach other people our system, then, we can really make a huge impact on the world. And that's the goal of this. So that basically is how the Preventative Health Practitioner program was born, right, in Preventative Health Institute. So two of the most common questions we get are, who is this program for? And then why is this program different than other programs out there? Okay, so I just wanted to go over those real quick. So who is this for? Okay, so two main characteristics you need. So number one, you need to understand that the body has this innate ability to heal. Okay, so if you take away the interference and step back, the body can heal itself. I mean, that is what this is all about. And eventually people will be able to just be in that state all the time, you know, who knows how many years from now. But right now people don't know, and we are bombarded just all the time by what is going on in our environment, what is being done to us. So people don't know. So if we're able to take away that interference, the body can heal itself. So you have to understand that, right? So you have to understand it's not just diet. I mean, many people think it's just diet, or maybe diet and exercise, or even mindset. There's a lot of that out there now, and those are all important, but really it all comes down to the environment and what is being done to it. So if we can teach people how to just focus on what they have control over, that's where people become empowered. And that's how we can lighten that body burden and really take enough burden off the body where people can heal. So that's what our system is all about. So you don't have to know all that, that's what we teach you, but you have to understand that. And then the other piece of that is that you have to have an entrepreneurial personality. So I think I read one time, it's like 3% of the population. So it's not for everyone. I mean, most people, want that job, that security, the IRA, or I don't even know what it is because I've never had a real job. But that retirement fund and the insurance, all of that. And if that's you, that's fine. But for people that have that real true entrepreneurial spirit, you have that, determination and that drive, and that you're decisive, you can make decisions, you understand that you're the creator of your own life. So it can be somebody that's just has that personality and is looking for that now, or it could be somebody that already has a brick and mortar practice and you want to add, a foundational health program to your existing practice. And obviously, if you have your own practice, you already have that, spirit within you. So we teach you these things, but those are the two things that you really need to have if you're going to take this program. So it could be, you could be a stay-at-home mom where you just want to have something that you can do from home, that you're, it's purposeful, you're helping other people, it's abundant, it's bringing enough money where you can live the lifestyle you want for you and your family. It could be a health coach, you've been through the programs, but now you're like, now what? What do I do now? And you need a system that actually works. It's proven to work. Or you could be a doctor, a chiropractor, somebody with some kind of a practitioner where you just want a health program to add to your existing business, to, give that optimal health to your patients, whatever it is. But you just need that entrepreneurial spirit and that knowledge that the body has that amazing ability to heal, because that's what all it comes down to. And then the other question that we get all the time is, why is our program different than anything else out there? And it really is. We always say everything. That kind of sums it up. So I just wrote down four reasons why our program is different. Okay, so it goes a lot more in depth than this, of course, but I just wanted to kind of give you the idea in this video. So number one, our program is based on real world data. So, this is something that we have been working on for years in our practice, in our businesses, working with people. We've always done functional medicine testing. So this is clinical data, this is test results, this is similarities, this is, patterns, this is outcomes, this is symptoms people came to us with. So we've taken all of this and put it together and just honed down the system that we use with every single person that we work with in our program, in our clinic. That is our foundational piece. So and this is something that people get hung up on. So if you're a health coach or maybe a practitioner that's wanting to add this to their program, this is where people get hung up, because it's, they have to come up with a system, they have to come up with a program, and then they don't know what to teach, and it takes a lot of time. So this is something that is proven, it works, so you don't have to take that time. You don't have to come up with something. You can just implement this. It is a proven system. Then we have the second piece would be that you go through this, we call it the Bodybuilding Boot Camp. That's our foundational program, because it's really lightening that body burden, kind of like, you know, what I talked about before. But you go through this as a client before you learn anything about how to be a PHP or about the business side of things. And this is kind of a twofold reason. So you go through it as a client, because we want you to optimize your own health, because you can help people best when you feel your best. Does that make sense? And then also, a good coach or a good, you know, mentor is someone that is walking the walk all the time. So if you're going to actually coach people and teach people how to do this, you need to be doing it yourself, so that you can say, hey, you know, this is what I do, or, you know, it's real world time. You can't be teaching someone how to do something and then going home and eating a bag of Doritos and smoking a pack of cigarettes, right? So, so we definitely put you through the program yourself first before you do anything else. Also, you know, I think I mentioned earlier, this is a tried and true system. We have used the same system on thousands of people. Everyone gets better. It's kind of like a recipe. So I use this analogy all the time, and maybe if you've been following us or you worked with us, you've heard me say this. So it's like a recipe. You do the 8 steps on the blueberry muffin recipe. You put it in the oven every time you get out a blueberry muffin, right? So this works for every single person, no matter what their symptoms are, as long as they do it. They have to have action. They have to implement these steps. So that's the one piece that only they can do. But it works time and time again for everyone. And then the other piece is time. So when you work with people, if you go through the program, make sure you're talking to people about time, because it took people time to get to where they are. Many, many years, right? So it takes time to turn this around. So everyone gets better at a different pace. So it's not like we can say, well, in 3 months you will be better. You know, there's just that time factor, but you will get better and better and better, no matter what. So, okay, so the third piece of this, and this is another piece where people get stuck. So I put that it's tried and true. We were talking about that, but people get stuck here because, you know, maybe they came up with a program, but it's also a shot in the dark. So they don't know for sure this will work, right? So we've already tried this on everybody. So just like what I was saying. But the other thing that we've tried is, so in our practice, we do functional testing with every patient we work with, because Dr. Duquette is a functional practitioner. But we have found that you don't really need the testing. Since this is based off of years of, you know, clinical research, we have found that as long as people do this program, and we've tested this out on many people without testing, they still get better. So they get better with the testing, they get better without the testing. And then the other piece of research that we've done over the last it's almost been a year. I guess at this point it's been 10 months. We've been working with people that have had the COVID shot. And I don't know that anyone else is doing this research besides us. I've not heard of anyone else. But we have almost a year under our belt where those people are also healing at the same rate as everyone else, okay? So again, it's your body has this amazing innate ability to heal. That's what it all comes down to. But you have to take away every piece of, you know, that body burden or the interference that you can. And then the other piece, number 4, is this is a business in a box. That's what we always call it. It's kind of like a franchise in a way. So, you know, we don't want you on our team to work for us, where we're the ones gaining all of the monetary value and you're working for peanuts. We want you working on your own. You're still on our team for the support and, you know, as we learn more, that type of thing. We're a team. We're working together for the same goal to help as many people as possible. But we want you, you know, to be abundant, because abundance is a big piece of being healthy and joyful and living a really happy, healthy life, right? So with this business in a box, that's one more piece where people get held up. So maybe they have their program they've come up with, you know, they're ready to go, but then they are stuck on how much do I charge? How much, or, you know, do I need a website? Now I need some emails, you know, all these things that take a lot of time to come up with. And, you know, when you work with us, take advantage of all of our years and years and years of failures and working. And, you know, we've been at this for a long time. So we're saving you tons of time, tons of money. But the business in a box basically is you get our proven program, right? But we have this in an online version. All our patients go through it. But then your client gets to go through this. They have lifetime access to this. It's a huge value to them that you are giving them. We have a community. We call it our Take Your Health Back Now community, where people, all of our clients are in, and we're posting in there every day. So, you know, basically it's me coming up with content every day to keep people engaged, keep people positive, keep people on this track. So again, you don't have to come up with all this content, which is a huge value to you and to your client. We have emails that generate, you know, every week that come out. We have documents that are already done. We have resources for you that are done. You even get a website. There's all of these things that take so much time and so much frustration and so much money when you are trying to come up with them yourself. So we have come up with all of this, and it's all, again, based on our practice and trying to make it better and better and better for our patients, okay? So now you have all of those tools in your toolbox, and that's huge value for you and your patients. See if I missed anything else. I think that's it. But, you know, the point of this, those are just two common questions that we get. But we also have a podcast tab. If you click on that on our website, it's podcast. We also videotape all of them, so if you prefer video. But, you know, each one of them kind of addresses a different topic, trying to, you know, get as much information across, questions that you may have. If this does resonate with you, you know, you watch those or you're just watching this and it resonates, you can set up a discovery call with us one-on-one. It'll be either with myself, Jenny, one of our team members. And, you know, if you have any other questions that we have not covered, or if you just want to get started, next steps, that kind of thing, you know, make a call, or, you know, just get set up. It's such an easy way to quickly go out and truly help people. And that's the goal for all of us, I think. You know, and we really want to change the world. We want to change this sick care system that people have been in for so long. And eventually, like I said, people will get to the point where, you know, everybody's healthy and happy, and we won't need any of this. But that's a long time out there, because people just don't know, and people are really suffering. So if this resonates with you, that's awesome. You know, check out our videos. We also have a Take Your Health Back Now podcast. We have a YouTube channel. We have our books, you know, if you want more information about us. But hopefully this resonates and you want to be on our team, and that would be really exciting. And let us know if you watched this and this resonated and you want to work with us. Okay.